how many acts have we had passed in Nigeria, and they've just sat on the shelf, right? The real work is not the acts getting passed, and it's
You talked about the passage of the Mental Health Act. Um, I wanted there's a two-part questions I want to ask. First things first, can you take us behind the scene of how that whole thing came together? Like, I know it was a lot of work, and how that happened. And I also wanted to like, what was your first reaction when you found out that the president actually signed the act?
I was elated. I was elated. This is something we'd worked on for a long time. This is something that Nigeria has never had. We're a minority of countries on the continent that have mental health reforms, and so it was really a great experience. It was elation, and I don't think that my parents. They don't really. I think when you get to a certain age, there's nothing that you do that really they clap for unless you're getting married and having kids. That's all they. If you tell them. Or maybe you buy them a car, they'll be happy or something like that. Buy them a house, but outside of that, there's not a lot of things I
Mm-hmm.
do that they clap for. But this one that that we had an event and we celebrated and things like that. They're really so I was really excited. It wasn't surprising to me that the president ultimately signed it because we hadn't got it this far before. And the president Buhari actually, whereas he might have has had his challenges, frankly, in a number of areas of reform, I think that in terms of disability advocacy, he's actually done very well. 4 years ago, almost to the day, he passed the Anti Discrimination Against Persons with Disability Act, which also brought about things like the National Commission on Persons with Disabilities. His wife has mentioned that he is somebody who was challenged with a mental health condition, that because of his days as a military ruler, he had PTSD. So he appointed an advisor on disability. So I think that in general, he was a champion for mental health reforms, and his family is a champion for mental health reforms. And so it wasn't a surprise that he passed it once we got to a certain point, and once finally the bill was sent to the president, which is something which was a historic feat that we'd faced. So it was elated, but I think I might have felt a little bit different than others. A lot of people were happy, but I knew some of the challenges with the bill. You know what I mean, in terms of the lack of voices that were there. But I knew that from my debate days that passing an act, how many acts have we had passed in Nigeria, and they've just sat on the shelf, right? The real work is not the acts getting passed, and it's a historic achievement and it's great. But in my debate days, we would have a card, a piece of evidence that said that 90% of policymaking is in enforcement and implementation. So it used to quantify the fact that a majority, a super majority, a super duper majority was in implementation. So I kind of felt like, great. We give ourselves an applause, but now is a real work of getting those things like a Department of Mental Health or a mental health assessment committee or a mental health fund passed. And some of those things weren't how they are going to operate weren't stipulated in the act. So there's a lot of work in terms of objectives, in terms of efforts. And so one of the things we did was on our website, we have a tab focused on the act, and we have recommendations from that were passed during public service or were submitted during the public hearing. And so we're looking at all those, and people can go. We have, and they can, if they submitted any recommendation to public hearing, they can reach out to us and we'll add it to our website. But we're looking through all those recommendations because all those recommendations, not all of it had made it into the act. And so we can look at it and see how we can mainstream some of those suggestions in the Mental Health Act going forward. So I kind of felt like I was elated, I was gratified, wasn't surprised, but I felt like now the real work starts in terms of implementing the act. And then just in terms of like the history of the act, like it dates back. I believe that it dated back to like the early 2000s, but I was told actually that it dates back to like the 1972. There are people that are pushing mental health reforms, and so you had in the early 2000s, people pushed for it. It lingered in the National Assembly. It was withdrawn. 6 years later, again in 2013, there was attempts. It failed again, and then in 2019, we find the version that finally ended up going. And there was a lot of challenges in the initial version, and I wrote about this, for instance, in Harvard Africa Policy Review in a piece with Hawa, from who's the founder of She Writes Women, and we outlined some of the challenges in the act, from the title of the act to the fact that it had, different things like still allowing sterilization for individuals who have a mental health condition, except for children. You know what I mean? The fact that it didn't have some the key human rights protection. So to see the further iterations incorporate some of those things, I thought was really good, and we are helpful. And so you don't make so even though it's not a perfect document, you don't make the perfect enemy of the good. And then, I just remember all the campaigns we did, from the demonstrations to the social media campaigns to the petitions to the open letters, right, to the advocacy visits. So it was a lot of going and appealing and talking to the different powers that be. And so I think that the best thing that happened at the conversations is that I think that people saw how robust civil society and different actors were, and that helped shape thinking going forward in terms of the implementation and making sure that those voices continue to be part of the conversation. And it was great, of being in interviews with, the Senate chairman, who helped who's head of the public health, who helped champion this, and him acknowledging the work of Nigerian Mental Health and other partners to get this across the finish line. And so it's been a great pleasure working with different partners to push these advocacy efforts, and I look forward to working with them in the future to see how much more we can get done.